Between 2000 and 2020, health workers have gone on nationwide industrial actions for at least 264 days, which is roughly 9 months. Since 2010, the country has barely gone 2 years without a strike by health workers, which affected all the states. The aggrieved unions are usually the Nigerian Association of Resident Doctors, the Nigerian Medical Association, Joint Health Sector Unions, Association of Medical Laboratory Scientists of Nigeria, or the National Association of Nigerian Nurses and Midwives. The issues triggering the strikes have not changed significantly since the start of the new millennium. They range from salary structures to payment of staff arrears, welfare packages, quality of hospital equipment, funding for training programs, and many others. A review of the industrial actions between April 2016 and April of 2017 shows that there were at least 17 nationwide strikes, out of which 6 were primarily within the healthcare sector. Many of the strikes are recorded to have caused the death of several patients in public hospitals who could not afford the services of healthcare professionals in private hospitals. In 2021, the Nigerian Association of Resident Doctors embarked on a 63-day strike following the failure of the government to meet its demands. Now, a bill which is sponsored by a member of the House of Representatives titled An Act to Amend the Trade Dispute Act 2004 to prohibit medical professionals in the employment of federal, state and local governments in the essential services sector from embarking on strikes and to accelerate administrative and judicial proceedings in the determination of trade disputes involving them is now generating tensions. The proposed law will only apply to medical professionals in government employment. But the resident doctors, while opposing the move, says it is against the right of workers to express their grievances using peaceful negotiations and, as a last resort, embarking on industrial action. To minimize the industrial actions, experts are advising the federal government to always respect all agreements made with the management of healthcare institutions, implement the National Health Act, ensure that only appropriately trained leaders and managers are given the responsibility of managing public hospitals, and work to ensure that salaries and financial remuneration are fair and paid on time, amongst other issues. The medical workers are also being advised to acquire the right set of skills and competence in leadership positions to manage healthcare facilities to prevent redundancy by the government. Amaka Udeh, Arise News.